Yes, welcome everybody. It's really lovely to see you all and to welcome you here today. My name is Elizabeth Dvergsten-Beauce, and I'm the social worker here with Lung Cancer Canada and the Airways of Hope program. I'm joining this presentation today from Treaty 1 territory, which are the lands of the Anishinaabe, Cree, Ojibwe, Dakota, and Dene peoples, and also the homeland of the Métis Nation. This webinar today about Scanxiety is the second webinar in a new educational series that the Airways of Hope program launched this summer. And that first presentation that we did, moving forward after a cancer diagnosis, the first part of that was recorded, and it can be found on the Lung Cancer Canada website under resources and then videos. So as with that presentation, the first part of this presentation will also be recorded. So again, we'll record up to and through, I guess, through the presentation portion, and then we'll stop just before we start the discussion. We want to respect confidentiality during that discussion component. So we'll just be recording the first portion of this presentation. And again, there will be time for questions and discussion during the second part of the presentation. So we'll hold questions until that part of it. And a reminder for anybody who's coming in, if you could just push mute on your microphones, and then we'll reduce the background noise. So, who is this webinar today for? Well, it's really for anyone who can relate to feelings of anxiety that are related to scans or tests or appointments. And it's for patients or loved ones as well. We recognize and know that Scanxiety can be felt and experienced by anybody who has experiences within lung cancer. Let's see, I'll try to move my screen. Oh, there we go. So in today's presentation, we'll talk a bit about the impact of lung cancer and how anxiety is a very common feeling that can be really present throughout the whole cancer continuum, from diagnosis to treatment to recovery and even through to the end of life. We'll then turn our focus to Scanxiety. And Scanxiety really is an excellent term that encompasses the emotional response that one can experience while undergoing or waiting for scans to diagnose or to monitor treatment or to check for a reoccurrence. And although Scanxiety is really a common experience, it can be really difficult to navigate and can hugely impact a person's quality of life. So the goal of this presentation today is to identify tips and strategies to cope with Scanxiety. Not necessarily to get rid of those feelings, but rather to find a better way to manage and to cope with and live with them actually. And as always, a reminder that if anything from today's conversation brings up any questions or concerns that you might have, please don't hesitate to speak with your healthcare team. That's what they're there for, and we certainly encourage that. So when we think about the impact of lung cancer, I mean, it really impacts all parts of life. It impacts physical health, emotional health, mental health. It impacts relationships. Day-to-day life is impacted, including work and finances and other practical parts of daily living. Living with lung cancer, whether you're on active treatment or not, can feel completely unpredictable. It can be inconsistent, and it can maybe even feel like you've lost a sense of control or there is no control in life right now. Sense of safety and security can also feel at risk, and it can be really difficult to cope with these ongoing changes that are related to lung cancer. And stress and anxiety, those are two really common and expected responses to the ways in which it feels like life has been turned completely upside down from lung cancer. Now, for many people, stress and anxiety are synonymous with one another. They're one and the same, but they're actually not the same. And this is a really important differentiation to make, particularly when we're talking about Scanxiety and ways to cope with it. So stress is our body's physiological response to a threatening experience. The cause of stress is external, like a cancer diagnosis or an upcoming test or an appointment. And stress is like our body's built-in alarm system. It helps us to respond to a problem or a threat. Now, anxiety, on the other hand, anxiety is an emotional reaction to stress that comes from within. It's internal. So again, stress is a really normal human response to an external stressor, so something that we deem to be threatening. And anxiety is the emotional response to those external stressors. And we'll continue to talk about this throughout the presentation, but I wanted to make this differentiation early on in the presentation because it's an important one to take note of. Because while we can't always control the external factors that cause us stress, like receiving a cancer diagnosis, or, we can't control the results from a scan, we can control the ways in which we respond to those stressors. And again, this is the goal of today's presentation, to find ways to alleviate anxiety, or in this case, scanxiety, which again is our emotional response to really stressful events like scans and tests and appointments.
Elizabeth,
Yes.
are you moving your presentation forward?
Yes, yes. Can you see that?
We are not seeing that.
Uh-oh. Okay, that's where we're running into problems. Let me see if I can. Okay, I'm going to stop my share, Michelle, and I'm going to start it again.
Yeah, that's what I probably would do.
Okay, let's see here. Well, I'll bring this back up. I'm going to bring it to the desktop. Okay, can you see that now?
Yes, much better.
Okay, good. So what I'm going to do is I'm going to go back. I just want to show that image right there. So of stress and anxiety. So again, you can see this, Michelle, right? Okay, I assume you can.
Yes.
Okay, great, thank you. So yeah, so this image I wanted to come back to because this is an important differentiation to make, which is where stress and anxiety, they feel often the same, but they're actually different. And the reason we differentiate them is because this is where we start to recognize and identify ways that we can cope with scanxiety. So stress, again, is that physiological response to a threat, and it's externally based. That's stressor, but stress is that kind of built-in, physiological response. And then anxiety is the emotional response to the stress. It's internally based. And that brings us to the next slide, which is right where I was at. So scanxiety, what is it? Well, for anyone who has experienced a cancer diagnosis, again, either a patient or a loved one, it is a very common experience to feel anxious in the period before or during tests and while waiting for results. Many people refer to these feelings as scanxiety, which is a term coined by author and cancer patient Bruce Feiler. In an article that he wrote for Time magazine in 2011, Bruce spoke of his love-hate relationship with scans. And I'll read this quote that's up on the screen right now. All patients have complicated relationships with their scans, not unlike the hate-love relationships we have with other technologies in our lives. We first learn that we have cancer from scans, then learn from them if that cancer has shrunk or disappeared, then learn if it has come back. Scans are like revolving doors, emotional roulette wheels that spin us around for a few days and then spit us out the other side. Land on red, we're in for another trip to Cancerland. Land on black, we have a few more months of freedom. Now, whether scans are being done for diagnosis or to monitor treatment or to check for a reoccurrence, they can feel scary and incredibly unnerving, and they can be difficult to navigate as well. And different levels of scanxiety can impact a person's quality of life in really big ways. So when we're thinking about what scanxiety looks like and the symptoms of it, it can be physical and or emotional in nature. It can range from mild to severe, and it can pop up at any time. So it can be really unpredictable in that way. Some physical symptoms that scanxiety presents with: people might have trouble eating or sleeping. They might have an increased heart rate or sweaty palms. They might experience nausea or restlessness or shortness of breath. Again, all a response to scans or upcoming appointments. Emotionally, people may feel angry or irritable. They may seem preoccupied or have difficulty focusing, or might even feel a lost sense of control. For some people, some people might also find the scans themselves very difficult and might experience heightened feelings of claustrophobia during the scan, or sensitivity to drinking the contrast dye, or even maybe having difficulty with needles. All of these can be symptoms of scanxiety. Now, symptoms of anxiety or scanxiety can also be related to other causes. Now, it's possible, again, in relating it to other, underlying causes, it's possible to have anxiety or scanxiety, and to also have symptoms related to other health problems, cancer or not cancer related. And it can also be possible to be experiencing side effects from medication that maybe make symptoms worse. So all of this to say, it can create a really complex and interwoven web that makes it hard to determine the underlying causes of the symptoms that you're experiencing. But when we think back to the difference between stress, again, stress being caused by external factors, and then anxiety, our emotional response to those stressors, it's really important to sift through and examine these complex factors so we can find really specific ways to better cope with what we're experiencing. And again, another reminder that if any of this brings up any questions or concerns you might have, take note of them and do reach out to your healthcare team to kind of work through them. So when we think about tips and strategies to cope with anxiety or scanxiety in this case, the goal again isn't to completely get rid of anxiety, although that would be really nice. It's not always realistic given the context of lung cancer. So our goal rather is to better manage it or to ease it. And one of the ways that I approach this is through a 3-step process using the acronym SEA, S-E-A. Cancer and scanxiety can make people feel like they're, almost lost or adrift at sea, and it can feel really lonely and heavy, dark, scary, uncertain, and even hopeless sometimes. But there are ways to move through these experiences, and that's why we're here today. So let's start with this C acronym and move through it step by step. So S stands for identifying those external stressors that we talked about. So with relation to scanxiety, those external stressors would be tests or scans. It would be appointments, maybe with your oncologist. It could even be thinking about that overall impact of cancer. But all of these things are outside of our control. And these stressors are often so loud and overwhelming that they take our attention and focus away from things that we can control, like how we cope with the stress. With scanxiety, the focus is on the scans and results and what they might reveal. We can't control these outcomes. That's how we know it's an external stressor. So it's really important to be very clear in identifying what those external stressors are. Step 2, E, stands for identifying emotions. So a part of this is to take your emotional temperature. How are you feeling these days? With scanxiety, anxiety is the emotional response to stress. And underneath that big umbrella of anxiety are feelings and emotions such as anger, fear, irritability, sadness, disconnect, grief. There's a whole lot of things that can be under that umbrella of anxiety. And anxiety ramps up when it feels like we have no control over a situation or its outcome. And that's really present with people who have experiences of scanxiety. Anxiety or scanxiety can also ramp up when it feels like our emotions are too big or too scary or overwhelming to deal with, and it feels like there's no space for them. So we want to feel like we can just kind of get rid of them or disregard them. But what happens when we do that is that, that scanxiety and the symptoms just, like ramp up and heighten even more. But we don't actually need to get rid of these emotions that are underneath the surface. We need to make space for them. And the first way to do that is to actually identify and acknowledge them. So that's where, taking your emotional temperature and checking in with yourself, that's where this comes from. And the last part of this C acronym is action. So identifying ways to take meaningful action. So all of what is really encompassed within this step is recognizing what's in your control and what isn't in your control. Again, as an example, we can't control the outcome of our tests, but we can manage our emotional response to them. And a part of that is identifying helpful tools that we can use and strategies to cope. So let's open up our toolbox and see what we might be able to add into that. So, some tools and strategies to cope with Scanxiety, again, using that template of C, SEA, identify the stressors, identify the emotional response, and then identify meaningful actions. And a part of the action piece is opening up that toolbox. So a part of that too is learning how you react. So identifying patterns of reaction. Everybody's different. So recognizing your body's reaction to Scanxiety can help you to better understand your own stress response. You might get an upset stomach before your scan, while for somebody else, they might seem really irritable while waiting for results. When you know how you respond, you can spot your signs of distress and then find ways to take meaningful action to relieve them. Now, the next one, it can really be easier said than done, setting time limits on conscious worries. It's really important to not let anxiety take over our thoughts 24/7. Again, easier said than done. But this could be a helpful strategy to try to engage with. So choosing a certain amount of time for each day, so 10 minutes, maybe once or twice a day, to focus on your fears. So to actually give it attention. And then when those thoughts arise at other times during the day, you can gently remind yourself to think about it at that scheduled time. So that's a way of making space for it, but not letting it completely take over. A way to do this, if you need to, and if it would be helpful, is to write down your fears so you can think them over at that designated time. And writing them down is actually a really helpful process for some, as a way of taking something that feels heavy and overwhelming on the inside and then externalizing it. Staying present, Scanxiety, it's interesting. Scanxiety is future oriented. It takes our focus away from the present moment and it focuses on what could potentially happen in the future and the impact it might have. So the focus with Scanxiety is future oriented. But if we focus on staying present in the moment, whether that's through cooking a meal or talking with a friend or walking your dog or spending time out in nature, it can really bring us back to the present moment. And that can be really helpful. And some other relaxation techniques that could also be helpful, breathing exercises have been proven to calm heart rates and ease anxiety. Meditation can help to focus our thoughts and keep a person in the present moment. Visualization can be especially helpful during scans and other procedures. Exercise and any form of body movement is also a proven stress reliever. And creative expression, either through art or dancing or knitting, whatever it might be that's creative for you, can also be really excellent ways to shift our focus and to relax and to come back into the present moment. Distraction can also be a really helpful tool. Finding ways to take your mind off of your anxiety or Scanxiety, streaming movies or music, listening to a binge-worthy podcast, reading the comics, that can be a fun and helpful thing I've heard from people, reading a magazine or a book, or even starting a new project, something that, again, distracts and shifts your focus to the present moment. Now, some practical things that can be helpful as well. Scheduling an early scan appointment time. This can really help to cut down your wait in the waiting room, which, the waiting room and waiting there, watching the time tick by can just be fuel for Scanxiety. So scheduling an early scan time or appointment time can be really helpful. And making your scan as comfortable as possible. So talk to your healthcare team ahead of time. about what will happen, so you know what you can expect during that actual appointment. And this can give you some time to prepare and to feel like you have a sense of control over what that experience will be like. Again, it's not about what that outcome will be, but rather how you cope within that moment. Ask for a blanket or eye cover, or even if you can use headphones to listen to music during those scans. This could really make a loud, confined scan less stressful and less anxiety provoking. If your scan involves needles or anything painful, ask your doctor for maybe numbing or other anti-pain medications. That could also be helpful in reducing the anxiety related to those scans. Talk with your doctor to decide when and how you'll get results. This is another really important, I think, opportunity that is often overlooked. So really having a clear plan that's decided beforehand with your doctor and making sure that everybody's clear of that plan. So do you want to receive your results in an email or a phone call or online or during an in-person visit? Be really clear about that. And if you'll discuss the results in person, schedule that appointment for as soon as possible after the scan and make that wish known to the healthcare team, so that can happen as quickly as possible. Again, to reduce that in between waiting time from the scan to the appointment. Again, that's where a lot of people experience scanxiety. So that is a way that you can better manage and cope with your response to that waiting time. Getting support from people who comfort you. Identify the people who bring you a sense of peace and calm and spend some time with them. You can even ask them to come to your appointment with you, either for good company or even as quiet comfort. That can also be helpful and meaningful for people. And, never underestimate the power of speaking to a professional like a counselor. Psychosocial support and counseling is often available at cancer centers or through disease-specific organizations such as Lung Cancer Canada. And that's part of what I do here at the organization as a social worker, is provide that emotional support for people. And oftentimes scanxiety is a very common experience that comes up for people. And we spend time talking about that. Joining a support group can also be really helpful. Also, this can be available at cancer centers or at organizations like Lung Cancer Canada. And if you aren't aware, we have a patient support group available that happens every month. So if that's something that's interesting and resonates for you and you're not connected yet to that group, let us know through an email later on and we'll get you connected. But yeah, speaking to a counselor and connecting to a support group can also be really meaningful ways to cope with scanxiety. And lastly, talk with your doctor about medication. If your anxiety symptoms are moderate to severe and you find them really difficult to cope with, anxiety medication could be helpful for you. There are lots of different types of medications out there. So, having a conversation with your doctor and going through and finding the best, most appropriate medication could be really helpful. And there are some different factors that they'll take into consideration, such as your needs, maybe potential side effects, other medications that you might be taking, as well as your medical history. But don't hesitate, again, to reach out to your healthcare team if you are experiencing scanxiety or just anxiety in general. Reach out. You don't have to go it alone. So to summarize, kind of some of the things that we've spoken about today, lung cancer impacts all parts of life and can really cause significant stress and scanxiety in this case for both patients and loved ones. And scanxiety, again, that emotional response that one can experience while undergoing scans for diagnosis or to monitor treatment or to check for a recurrence, that's a very common response to a very stressful experience. And it can be really difficult to navigate and can hugely impact a person's quality of life. And one way to navigate those turbulent seas of scanxiety is with that acronym C, S-E-A. So identifying the external stressor, so in this case, a scan or appointment. Identifying emotions, so again, that internal response to a stressor. And then that third step, which is A, identifying meaningful ways to take action, SEA. So, in conclusion, oh, I pushed that too soon. In conclusion, Scanxiety, again, it's a really normal response to a really stressful experience, which is lung cancer. And cancer is hard. So it's important to treat yourself with kindness and compassion. And again, to remember that you're not alone and you don't have to go it alone. So to consult with your healthcare team, talk to a counselor, join a support group, reach out for support from loved ones. There are lots of different ways that we can take meaningful action to cope with Scanxiety. So thank you very much for joining this webinar today.